Good morning. This is the Blaine's World webcast that can be found each week on Facebook, YouTube, and LinkedIn. You can also listen in on Spotify or Apple Podcasts. You get more information and find out about previous shows on our website, which is behind me, www.blainesworld.net. I'm your host, Blaine Greenfield, and I'm here in my Zoom studio in lovely downtown Fairview, North Carolina. Each week, we focus on positive news and information about people and organizations in both Western North Carolina and throughout the country. And toward that end, it's my pleasure to introduce Abby Landry, who's the Medicare Program Manager at the Council of Aging, Buncombe County, for being a guest today. And thanks, Abby, for joining us.
Thank you for having me.
Okay, what you can do, you can also wave to all your fans and friends who are watching this. So if they're watching you, you can give a big, that's Abby. Abby is a native of Western North Carolina, has been working with older adults for over 14 years. It's really cool. So you started when you were 7 years old? You were like the youngest?
Yeah.
The youngest person ever to work with, although that's really cool. As a health and aging promoter and advocate, she finds fulfillment in providing education and resources to adults, helping them age successfully. As I mentioned to you off the air, it must be a really cool job you have because you're just helping people, I guess, right? And that's
Essentially, yes. Yep. We
kind of.
are helping people at the Council on Aging that are 60 and older with all different aging services.
Now, let me ask you, in terms of as a child, remind me, we spoke once before, as a child, you grew up where?
I grew up in Waynesville, North Carolina.
Okay, and so you're growing up in Waynesville, North Carolina. Did you always know you wanted to be an advocate for the elderly population?
I did not actually.
Yeah. So how'd you get into it?
So my degree is actually in foods and nutrition. And when I was coming out of college, I was looking for somewhere to get started, get a full-time job. And my first job was a wellness coordinator at a retirement community. And nutrition kind of fit within that role. And I had studied nutrition through the life cycles. So even though I had not set out to really directly work with older adults, that's where I first started. And through that, the love of wellness plus aging really evolved, and I became more and more passionate about it through time. And with the Council on Aging, as we say, everyone has the opportunity to age successfully. I always say that there's a big wellness wheel that we should think about when it comes to aging successfully. And we need to have good socialization. We need to have good nutrition, a good attitude, good financial wellness and physical wellness, the whole big picture. And the Council on Aging really fits within that whole wellness wheel. And for me, the Medicare program kind of fits with that financial wellness kind of aspect. Health insurance ties in with our finances. And in this country, we have to have health insurance to really get the best services maybe we could get medically.
One of the great things, I guess, about this job for you and for the community as well, is that there's always going to be a job, I assume, for you. You know, it's
Yes.
something that with our aging population, not only in Buncombe County, throughout the country, it's not going to go away, I guess. You know, there's always going to be people needing help with aging. And so with that in mind, I've always heard of the Council of Aging, but what exactly is the Council of Aging? Then we'll talk about your position with it.
Sure. The Council on Aging is a 501c3 nonprofit, and we primarily help adults that are 60 and older with aging services. So that is a variety of services you could think of almost that we can help you with, from transportation needs to dining and wellness to elder care law, insurance, almost anything you can think of that you would need assistance with through the aging process, especially after the age of 60. We are there to help you, and we don't charge for any of our services that we offer to the community.
How many people work where you are?
Let's see, we have about 10 full-time staff on right now, and then we have a large number of volunteers that really help us run that organization as well.
Okay, and since you mentioned it, let's just digress a little bit, which is cool. So people can come and serve as a volunteer. What do you volunteers do? And talk about the process of becoming a volunteer.
Yes, so we have different programs under the Council on Aging, and volunteers can help with, it could be the Call a Ride program, so that could be helping drive someone to an appointment from their home, or they could help deliver food for our homebound food delivery program. In my department, the Medicare department, we have 16 volunteers that are certified to do Medicare counseling. And then we also have a team under the Affordable Care Act Navigator team that helps folks that are actually between 19 and 64. So I'd used the word primarily earlier when I described who the Council on Aging serves. Primarily 60 and older adults, but we do have one program that can help folks that are 19 to 64 with their insurance needs as well. And we have volunteers that help with that. And then if
By the
people
way,
are just interested in office volunteering, they can help us do stuff around the office.
you mentioned that one program. What program is that you'll take people, you work with people under 60? What program is that?
It's the Affordable Care Act Navigator team. And in North Carolina last year, some people may have heard the term expanded Medicaid. And North Carolina expanded Medicaid last year. And with that program, there are Affordable Care Act navigators that can help folks find health insurance between the ages of 19 and 64. So that's our one program where we kind of deviate a little bit off of that age 60.
So if people want to volunteer, for example, what do they do?
They would call us and we would have an application for them to fill out. Depending on what program and what type of work they wanted to do, then we might have to do a background check. We might have to check some other things. But basically, they just need to call the Council on Aging, speak with the program director, and then they can tell them what they would need to do to volunteer with us.
And since you mentioned it, and we'll come back to it at the end, but right now you said to call you. If you would please, both the phone number and then the website. How do you
Sure.
get in touch with you?
Yeah, the phone number is 828-277-8288, and the website is www.coabc.org.
Okay, I'm going to ask you to do that once again. Just the phone number again was what?
828-277-8288.
And if you would spell out the acronym. So you mentioned the letters, but go the letters again, and then what does it stand for?
Council on Aging of Buncombe County.
Okay, and the website was what?
www.coabc.org.
And let me ask you, in terms of if somebody wants to get involved, why should somebody serve as a volunteer? Or what do you tell them as to the reason for volunteering?
Well, our organization, like I said, we have about 10 full-time staff, and in my program alone, which is the Medicare program, we help adults all year round with counseling sessions. And during open enrollment, which is only October 15th through December 7th, our program alone in Buncombe County and Henderson County, the two SHIP sites that we are in charge of, we'll see over 500 to 600 adults just through open enrollment season.
And so, I'm
yeah.
sorry, but with 10 people, I guess that'd be kind of hard to see
Well,
that number
I
of
only have
people.
2 people in my department. That's just the
Oh,
Medicare program. So we're helping over thousands of people all year round, 10,000 more people all year round with services that are for aging. And we have congregate dining sites. We have a lot of homebound food delivery. So volunteers really make those programs happen, and we could not do it without them.
and talk, if you would, Abby, then about your specific department, the Medicare aspect of this. You're the just trying to see your title here is the Medicare. What's the title again?
The Medicare program manager.
Manager. And so, what exactly then, if people contact you or look to you for help, what kind of help do you provide people? So they have to qualify for Medicare, or what's the process?
So we do help people that are on Medicare or getting to go or about to go on Medicare, or caregivers and people that support people that are on Medicare. So Medicare is primarily for folks that are 65 and older. There's some exceptions to that rule, but that is the basis of who is on Medicare. When you turn 65 in this country, then your health insurance from here on out is going to be Medicare. And some folks know that it is a very confusing system. It's very complex. And so our team is there to help people understand the pathways. There are essentially two pathways to Medicare that you can choose. So we are there to help educate about those pathways, educate how Medicare health insurance works. And then we help folks compare different plans depending on their zip code. And we help them find the best insurance for their needs. And with our program, the Medicare program, which you might also see on our website, the logo SHIP. It stands for Seniors Health Insurance Information Program, and it's a little ship symbol. So we are sponsored by the North Carolina Department of Insurance, and through them, we are able to provide this education, and it's through them that we are all certified as SHIP counselors, and we can provide accurate information for beneficiaries.
And so this seems to be a really worthwhile thing that folks to get involved in terms of volunteering. If they want to be a SHIP counselor, they could become one?
Yes, they can. And most of my SHIP volunteers have been doing this for 5+ years, and we have a team of about 15. And they are some of the best people that can help you understand Medicare and pick out the best choices for yourself that you could.
What's a shame is that it's as complicated as it is. You know, you would think that, I mean, it's almost like taxes as well, that wouldn't it be cool if you could just go to a website, sign up, and you're in business tomorrow, but you actually need counseling, or a lot of people do, including yours truly. What does the counseling do where if somebody calls you up, for example, and just, I guess the best time to do this is before they become 65, right? They should, how
Yes.
far in advance?
You can sign up 3 months before.
Okay. And so when you sign up 3 months before, what then happens? How do you, what's the process like?
So you sign up through Social Security Administration. That's the first thing you do. People might think that you would call Medicare and say, I'm ready to
Right.
enroll in Medicare, but you don't. You call the Social Security Administration, and we definitely have partnerships with the Buncombe County Social Security Administration. So I highly encourage folks, if they are new and they have any questions or surrounding, should I take Part A? Should I take Part B? Should I hold off on it? Go up there and set up an appointment with Buncombe County SSA or Henderson County SSA, because we're over both counties, and do it in person. And they have people there that can walk you through that whole process. But after that, once you have Part A and B, you're ready to come see one of our counselors at the Council on Aging, and you would call, you would talk to our Medicare assistant, Jennifer. She would get some information about you and set you up with either an in-person appointment in your county or a phone appointment. So we have counselors that do both. Some are just dedicated to phone appointments, and then we have some that come in person. And we'll give you about a 1-hour appointment to go over your needs. And if we don't meet those needs within the 1 hour, we will continue to follow up and make sure that you understand what's going on before we just let you go.
What if you miss the a date? You know, as you said, sign up 3 months before 65. I imagine, which is unfortunate, but there are some people, I guess, who don't not only sign up 3 months before, but it's possible some people never sign up or never get enrolled in the program.
Sure, you can miss that initial, it's called an initial enrollment period. If you miss your initial enrollment period, there is a general enrollment period every year between January and March 31st. So that's like your second window you can try to get in.
Now, if you miss it, is it ever retroactive, or you miss it for the year, you have to get it next year?
You still have a window, but you want to make sure that you sign up as soon as you can, because you can incur some penalties that would last a lifetime. So it's most important, and you never want to go without what we call creditable coverage, meaning you have health insurance that helps pay for your drugs and your hospital and your doctors. So you don't ever want to be caught without any. So we're there to help transition, whether you're coming off of a group health plan, like an employer group health plan, or you're coming off of Affordable Care Act, whatever type of plan you're going to be transitioning from, we're there to help make sure that you do understand the timelines and why you need to do it in a timely manner.
So when I contact you folks in a timely manner, I sit at school, you can come in actually and see somebody face to face, or it can be over the phone or face. I don't know if you do video calls as well. But what does that entail? What do I have to bring with me or have available to me when I see you?
So if you have enrolled in Parts A and B and you have your Medicare card or your Medicare number, we always like for you to bring your Medicare card or your Medicare number. If you're brand new and you haven't gotten your card yet, then you can call Medicare or you can call SSA and get your Medicare number. After that, you want to make sure that you bring a current list of any medications that you take with the accurate dosages and a current list of providers that you prefer to use. And then what we do is we search a medicare.gov, medicare.gov database with your drugs, your providers, your zip code. And then that will give us, it'll give us comparisons for whatever we're looking for, whether it be a Part D drug plan, a Medicare Advantage plan, or a Medigap/supplement.
What's a shame as you're talking about it is the fact that people are never taught this kind of stuff. In other words, we go to school all our life, or not all our life, but we go to school, elementary school, high school, college, whatever, and you learn a lot of cool stuff, but never, this is like real valuable stuff. But after you graduate college or high school, whatever, nobody ever tells you that this is the stuff you really need,
Yeah.
And it's a shame. But again, back to what you folks do. So talk a little bit about also, we mentioned off the air, you folks are also running some workshops coming up. Is that correct?
We do. So that's part of our program, and we offer seminars and classes throughout Buncombe and Henderson counties throughout the year. And interesting fact too, this year, more people are turning 65 than ever before. The coined term has been peak 65. And if you're on social media, it's hashtag peak 65. So there are more people turning 65 than ever this year, and we're really out in the community trying to promote our seminars and classes. So we have a few different presentations that we offer, but two that are getting ready to come up are Introduction to Medicare classes. And those are some of the best classes you could come to if you wanted to learn about Medicare. We're going to be on April 24th at the Hendersonville Public Library and on May 1st at the Inca Candler Public Library. And if folks are interested in joining us at any of these classes, they just need to go to our website and click on the events tab at the top and then find whichever class you want to come to and register from there. We also offer some Medicare basics seminars that are a 1 hour engagement, and we have one coming up on April 29th at Gross United Methodist Church in Asheville. And then one other thing we help folks with surrounding the topic of Medicare is Medicare fraud, scams, and abuse. So we try to promote folks reading their Medicare summary notices that come to them quarterly in the mail and making sure that the services you've been rendered are actually listed correctly and accurately. All the providers are your providers and you've been serviced in those correct locations. And if not, then we can help them file a report. But one way to take care of not getting fraud, not having risk of identity theft is making sure that you shred sensitive documents like those Medicare summary notices. So we're going to have a shredathon/shredfest on May 14th at Carrier Park in Asheville. And if you're an older adult, you've got some files, some sensitive documents that you would like to shred, we will have ProShred there, and they will be helping us securely shred those documents and get rid of them for you. So if you know anybody, you're welcome to come on May 14th. We're going to have some vendors there that can talk to folks about Medicare fraud, like AARP, Buncombe County Social Security Administration, and maybe some of our partners like Land of Sky. So feel free to tell anybody you know if they need to shred some documents, they can look us up and come to that event.
And again, the date of that was what?
May 14th,
And it's going
and
to be
it'll be
where?
from 1 to 3 in the afternoon at Carrier Park.
Okay. And so also folks want to find out information about that as well, or to be reminded, that's also going to be at the website.
Yes, it will be at the website, and then they can call us at 828-277-8288.
Let me ask you if you know it, and I'm asking for a reason. The Council of Aging of Buncombe County, how long has it been in existence?
Yes, so we are 60 years old as of 2024. And
Because,
my running joke in the Medicare classes is we're not quite eligible for Medicare yet.
okay, okay, close. But as you're talking, it's funny, it's all coming back to me. I then went to a workshop, for sure, when I became 65. And it was at the time it was at a library, I think. And just exactly what you said, I remember it. It was like overwhelming to me the very first time you hear it.
Yeah,
And so I guess what you're saying, and it was my experience, get to a workshop if you can, get an overview, and then you can then work with someone on a one-on-one basis. Is that the best way to do it?
absolutely. That's exactly what we will try to recommend folks to do. You can start light and you can go to a Medicare 101, 1 hour. We'll give you just the brush over, teach you the pathways. But if you need more than that, then we say try going to the intro to Medicare class. It's 2 hours. We're going to dive in deeper. And then after that, call us. We'll set you up for a one-on-one and you can really get everything you need.
That's exactly now I recall what I did, because again, I went to the first session and I'm relatively intelligent, but that was like overwhelming to me. It's just so much
Yeah.
stuff. I wasn't ready for it. But again, it evolves. Let me ask you this too. Do you also offer any of this via video, or are there programs people can watch to find out some of this stuff?
So right now we don't have any recordings, but that is on my radar. I would like to host some webinars where we do some education like the Medicare 101s, but I would like to do some recordings where we can teach simple things like how to set up a Medicare.gov account, how to use that Medicare.gov account, and some reminders about important times of the year like open enrollment and general enrollment times. So I do have plans to set up some recordings that are easy to access and we could place them on the website.
Because I'm also thinking out loud with you, with just what you said. You could also just try it on a trial basis, just tape your introductory workshop, without something
Right.
special, but, at the library, so you don't have to do anything extra, but just, it'd be a fun thing to just try. And wherever it comes out, it'll come out, but you have nothing to lose, so it's not
Yeah.
extra time. But I would think some of this stuff would be very valuable to watch. And then, like you said, people then want to watch it, and then they can come in to see it, to speak to somebody.
Right.
Because I'm trying to think, yeah, or even when you weren't there with COVID, but what do you folks do when COVID took place? You weren't having the in-person workshops.
Right. I was not there during COVID. So I think they primarily were doing phone appointments.
Gotcha.
Yeah.
Okay. I
And
guess
that's the good thing about this is we can still do it over the phone. I think it's better to have some type of visual, but some people are auditory learners, and so they would prefer a phone appointment.
Brooke, also you mentioned about Medicare fraud or fraud in general. So if somebody suspects something or something is not right, what should they do at that point in time?
Yeah, so if someone suspects that something is not right, you can either call a SHIP site like we are at the Council on Aging. You can call the Council on Aging and say you would like to speak with someone in the SHIP department, SHIIP, or that would be on the local level. Or if you were in North Carolina, there is a 1-800 number, and I forgive you that I don't know that number off
Sure.
the top of my head, but you can call North Carolina SHIP, SHIIP, and they have representatives that will help you through that process. Or you can call Medicare, and that number is on your Medicare summary notice. If you suspect that something is not correct, then you call that 1-800 number and tell the representative that you need to report Medicare fraud. And then they will ask you to provide some information that's on that Medicare summary notice, and they'll take a report. And it's very important that people report anything like that so that it protects their identity, it protects their medical history, and we can get to these fake providers that are trying to scam and abuse and make sure that they don't continue to do so.
aside from the shredding program you mentioned that's coming up, which is a pretty cool thing that you're offering, no charge for this and take all your stuff. What else should folks do to make sure they don't get scammed?
Yeah, you want to protect your Medicare card just like you would protect your Social Security card or a bank card. So your Medicare card is the red, white, and blue paper card. So that can sometimes throw folks off that are new to Medicare. You get this letter in the mail and it's not a plastic card. Sometimes people toss it. So you want to make sure that you're reading all your mail first. Then save that Medicare card, and at our ship sites, we have little plastic Medicare card holders if anybody ever needs those. But make sure you keep it in a safe location. Make sure that you don't just give that number out to anyone. If someone calls you over the phone and requests that number, they are most likely a scammer. Medicare does not call people. Social Security does not call people. So if someone calls and they're imitating that, you need to just hang the phone up. One of the next best things to do is make sure you're reviewing all those Medicare summary notices, like I said, so that everything is accurate. And if you suspect anything at all, report it as soon as possible.
You mentioned reporting it to where specifically? Your office or?
You can call the Council on Aging, and we can set you up with a SHIP counselor to help you through that, or you can call North Carolina SHIP, or you can call Medicare.
It's scary that as you're talking about this, unfortunately, scams are not lessening, they're getting worse, it seems like, and more people getting scammed by that. And part of the problem is, the information they'll give over the phone, and you may have read
Yes.
about one fairly recently that happened to actually a friend of ours, that they pretended they were somebody, whatever, they gave away all the information, and they kept getting more and more into it, and I don't know if you've heard this one, but people are even told, don't tell anybody, don't tell your husband, don't tell your spouse,
Okay.
and scary stuff that a lot of people get taken for a lot of stuff,
Yeah.
So let me ask you that too, in terms of Medicare fraud. So what could happen if somebody is scammed? In other words, you said, guard your card, guard your information. What if it gets out? What's the worst that could happen?
So you could get billed more than you're supposed to for services that you didn't have. It can mess up your medical history. So say you get billed for some kind of procedure or some kind of test that you never had, then the doctors that you see after that see this on your history. It's gonna mess up your history, and that's not what you need. You need your physical history to be accurate. They can steal your identity at some point. The other thing is, if you feel like you've had Medicare fraud, Medicare is really on top of it. And from my experience with the reporting, if they suspect any fraud, they will go ahead and send you a new Medicare card. But if you definitely have had some scam or some fraud and you're in that report, you're reporting that, then make sure you ask Medicare if they can send you a new card and issue you a new number. And that will help. And then from then on, you want to protect that number, as I said, and not give that number away to anyone unless it's a provider. And one of the best things to do, if you possibly can, and I know that it's difficult, if you don't recognize it, if you can see the number on your phone and you don't recognize it, just don't answer it. And then whoever does need to talk to you, they'll leave you a message or they'll call you back.
And by the way, that's really good advice, because a lot of people don't realize it, that you don't have to answer every phone call, so not just with respect to Medicare, but anything.
Right.
My answer is the same as yours, that if you don't know a number, just don't pick it up. Well, it's incredible, Abby, that people pick up calls that even say potential spam on, and
Right.
or I don't know about folks you deal with, but certainly this was my mother at the time and other people. They just pick up every call. What's worse, they not only open every piece of mail, which isn't a bad idea, but respond to every piece of mail. I tell the story of my mother that she was getting TV Guide for like 27 years, because every time she got a renewal notice, she would immediately send a check. So even though she already had paid it, some companies just keep billing and billing. So I
Yeah.
guess what I hear you saying is that if one thing that council on aging can do is help just folks get smarter, and be aware of stuff. And you said it's kind of, now I know it, so it's primarily people over 60, is that correct?
For Medicare?
Yeah, or just in terms of working with your office, council on aging is primarily for people over 60 or
Yes,
over
primarily.
over 59 or over 60?
60 and older.
Okay, 60 and older. So the best thing I heard you say too is that you should think about this in advance of becoming 60. It's kind of a crucial date because that's when you got to start kicking in everything,
Yeah.
where like you said, ideally 3 months before. And last question is, what's the latest you can apply? So I missed the 60. If you miss a couple of years, can you apply at 62 or 65 if you never did it?
You can still apply, yeah, and if you have not, and you're eligible, then you definitely need to go ahead and try to enroll. But there's sometimes when people have great group health plans where they
Right.
can take Part A and they don't need to take Part B because they have creditable coverage. So if you aren't sure if you're going to have creditable coverage, that's another area where you can come talk to one of our SHIP counselors and they can help talk you through if you need to transition off of a group health plan after some time and get into enrolling in parts A and B, and then choosing which pathway you need from there.
But again, I guess the recommendation would be to apply, worry about what's best and whatnot, but at least get the application in as soon as you can to start getting
Right.
the stuff going.
Right. So everyone has an initial enrollment period, which is 3 months before their 65th birthday, the month of the birthday, and 3 months after. So you have 7 months to to take care of that process. And we always recommend you do it on the first part of it, the first 3 months, then just get it taken care of and you don't have to worry about it.
And to recap, Abby, a couple of things you said. So in general, if they want to get more information about the Council on Aging, best bet is to do what? Go to the website or phone?
Yeah, the website, coabc.org, or we have a Facebook page. It's the Council on Aging of Buncombe County. And we have an Instagram account. It's Council on Aging _BC. So you can reach us through the web or through social media. And then, like I said, you can call us at 828-277-8288.
Okay.
You can also walk into the office. We have walk-ins all the time too.
Okay. And where is the office, by the way?
We're located in the Deerfield Retirement Community. There's a chapel on campus there right after you pull onto campus, and we're in the first floor of St. Giles Chapel.
What a great location for
It
the
is.
facility. In Hendersonville, where are you located?
In Hendersonville, we have SHIP sites at the Council on Aging of Henderson County. So there is a Council on Aging there. We have one SHIP site there, and then we have one SHIP site at an Advent Health that's in Hendersonville as well.
Okay. And lastly, mentioned that a couple of very exciting workshops coming up. So especially if people are interested in finding out more information, those workshops again are what dates and locations?
Yes, April 24th and May 5th. April 24th is at Hendersonville Library. May 1st. May 1st is at Inca Candler Library. And those are our 2-hour intro to Medicare classes. And then on April 29th, we're going to be at Gross United Methodist Church doing the 1-hour Medicare 101 seminar. And then on May 14th at Carrier Park from 1 to 3, the Shredathon.
Again, I'll just make a personal recommendation, but if somebody is interested or their family, relatives, neighbors, whatever, get them to one of these workshops because again, and now I recall I did it so many years ago, but it's a great way to get started, so
It is.
thank you certainly for the work you're doing, Abby, for the Council of Aging of Buncombe County, and thanks for being my guest. Also, I'd like to thank my producer, Cappy Tassetti, and hopefully we'll see you at some point in time in the future again. Thanks.
Sounds great. Thank
Okay,
you.
great.